Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey Maya, welcome to Office Hours. How are you doing?
I'm doing all right. Very glad to be here. Thank you, Toby. How are you?
Everything's going really well with me. It's really nice to have you as our first guest. I wonder if you might want to give people like a little bit of your background, your like educational background, and your practice experience so far, if you don't mind. So as we discuss everything today, people will have a little bit more of your background.
I'm a recently new practitioner.
Mhm.
I graduated last year in August and got licensed in California in October, and then finished my national licensing process in December. So I've been practicing for a little under a year. I'm now living and working in Northampton in Western Massachusetts, which is how I met Angelique,
Mhm.
at a practice called Whole Body Healing, Acupuncture and Wellness, where there's an acupuncturist named Liz who started the practice and over the years has hired three other practitioners to work with her.
Mm.
It's a clinic that primarily sees insurance patients, which is an amazing magical thing about being in Massachusetts, which I know Angelique has spoken about on this podcast.
Mhm.
Mhm.
And so I've been there for about 3 months now, maybe four, and really enjoying it.
Any type of specialty associated with that clinic, or is it just general health?
The clinic doesn't have a specialty, wholehearted generalists. Of course, every practitioner within the clinic, there is a total of four of us. Every one of
Hmm.
us has some different leanings. I would say Liz and Tim practice pretty much traditional Chinese medicine, but having observed them both, and they've both been practicing for a number of years. I think Liz has been in practice for 17 years. I've noticed they do a lot of palpating, things that, one can say a practitioner practices primarily TCM, but that too can look so many different ways.
Yeah.
Mhm.
Um, and we, of course, so the third practitioner, Melanie, and I both trained at Acupuncture and Integrative Medicine College in Berkeley, California.
Hmm.
And that, of course, teaches towards the California boards, which are traditional Chinese medicine. And yeah, we enjoy sort of different things, but neither of us has really gone down any very specific rabbit holes, with the exception of me taking your CEU through White Pine Circle in June and
Mhm.
then going down the Somme rabbit hole,
Oh,
which I've
great.
been which I've been enjoying.
Yeah.
Okay, that,
Yeah.
that that's great to hear. I look forward to exploring that a little bit with you. What
Yeah.
about how was your experience with kale? And think about before you answer that, I've written a couple dozen questions for it, so be careful with what you.
Be
Um,
honest, it's okay.
how was I thought it was quite a friendly exam
Yeah.
considering the psychological warfare that I had been going through prior. It's funny with today's political climate, you really have to take into consideration how dramatic you are with your language. Hard to compare an exam to some of what's going on. That being said, it's exhausting to prepare for something the
Yeah.
dimensions of which you aren't sure of and the scope of which you aren't clear on, or the scope of which is so massive that it threatens to like eat you whole.
Mm,
Um, I thought Kale was much more reasonable and friendly than
Mm.
nationals.
really?
Um, Oh, hands down.
Wow.
Yes, I would take Kale four times over taking any of those national exams.
No kidding.
That's great.
Yeah.
If you guys ever have the opportunity to work for the boards, I strongly encourage you to do it because the compensation is really low. It's kind of hard work and things like that. But it's really rewarding to just kind of shape, like the entry that students are going to take into the profession. It's really nice to get. We had so many, like when I first got there, so many really bad, confusing questions. And so it
Hmm.
was really nice to clean those out of the way and try and make some more straightforward questions. So if you guys ever have the opportunity, I really encourage it.
Well, I'm very grateful for that because nationals are confusing and
Mm.
it seems counterproductive for what we're trying to do, which is get more people in the profession, right?
Right.
Yeah.
Um, so
Yeah, I have a little bit of news about that. Speaking about getting more people in the profession, I was just reading yesterday. I'll put a link about it in here about we have another Chinese medical school, Dr. Hammer, the Shun Hammer pulse
yeah.
reading
Hmm.
in Florida.
Yeah.
Somebody's doing it like reporting on like how the schools are doing, and the financials for that school are horrible. And the conclusion was it's surprising they're even letting anybody in anymore. So I'll put a link to that article. But again, just another Chinese medical school in trouble.
Yeah.
And this really concerning. I don't know the solution to this, but this really concerning for me, just how much strain
Yeah.
the schools are going down, and then and as at the same time as the demand for Chinese medicine, so much ill health out there, and the demand for Chinese medicine going up. So
Mm-hmm.
I'm
Yeah.
not sure where this direction this is going to go in, but again, just more concerning information I was reading yesterday.
Great, Toby. Thank you for encouraging us first to
Good, good.
take
Yeah.
low-paying hard work, and second for giving us wonderful news to
Okay,
brighten us.
but anyways, this means more patients for new practitioners. So I guess that's I mean, if we want to look at the silver lining of this, right?
Yeah.
Not many more people coming through the chute
Um,
practitioner wise, so we're gonna all be pretty
no.
busy.
Yeah, it would be great to have more people coming through the chute. It will be interesting, especially like in Massachusetts. I don't know how things are going in California right now, but in Massachusetts, to see your primary care, you're needing to book out. They won't see me till April.
So
So,
terrible.
and this was booked 3 months ago.
Yeah.
Mm,
So almost a year. And you know, in California, we can acupuncturists can be primary care practitioners. Here we can't, providers here we can't. But we still sometimes are the first medical practitioner someone sees with a condition who might say, this is a red flag. You need to have this looked at urgently because they might not be seeing anyone else. And
Mm-hmm.
my boss Liz was just telling me the other day that whereas it used to be even 5 years ago when she saw a concerning case and she said, have you spoken to your primary care about this? 80% of the time the answer was yes. She said
mm.
now 80% of the time or 70% of the time the answer is, well, I have an appointment with them in 3 months, but I'll tell them when I see them.
I concur. Same.
So, yeah,
Mm-hmm.
concerning.
What about Angelique, especially with your dual background? Is that do you really push the patients more when you see those red flags?
Yeah,
Can you okay?
I
Even
sure
if even
do.
if even if they can't get care, do you have any
I'll send them
special
to
tips?
urgent care.
Yeah,
You know, if it's
directly to
that much of
urgent.
a red flag, like with the patient I talked about, I think in the first episode, when there's like a raging infection happening, like you need to go to the hospital. You need
Mm,
to go to the urgent care, at least urgent care first. You know, if it's something nothing life-threatening, like I haven't seen anything truly life-threatening. I mean, one could argue that that may have been had it been let to marinate for a while
mm,
longer, but
Yeah.
um, something of a more urgent nature, urgent care is faster usually than the ER. They're not spending hours and hours there, and they'll at least get screened to see if they then have to be going to the ER or not. So it's at
mm.
least getting a point of contact with somebody who can, you know, evaluate, prescribe medication, do labs, whatever, or send them to the next level of care. Yeah, I've done that on a
Yeah.
couple occasions.
I never thought part of my job was going to be talking people into going to see Western medical doctors. Um, I'm just so surprised about this because I thought patients were going to be coming already like not so traumatized from the Western side, right? That I think that's a big problem. People tend to, it's hard to get in, expensive and things like that, but also some of their experiences they've had have been so traumatic for them that they just don't want to take it on for even really serious things. So yeah,
Hmm.
I never foresaw that being, a chunk of my job is to talk people into definitely try and go. So.
Or being the ones that help to reset the nervous system as a result of someone having gone through the medical system or who is currently going through the medical system and going through multiple specialists. Like I've got a patient now that's going to multiple specialists, and she was like, every time I go to someone, they just order more tests and then it's more waiting.
Mm,
And it's just like helping them cope with the constant waiting that will then yield another result, send them to another specialist. It's like a hamster wheel of doom in the medical system. And then the specialists don't talk to each other all that well. So like results are coming through and aren't getting to the next person. And it's really it's very nerve-wracking for people. Yeah.
Yeah, I
yeah.
wonder sometimes about coaching patients in the sense of advocacy, right? Because as you know, Angelique, because you've been part of the Western medicine system, and Toby, it sounds like you know through your patients, but probably also through your experience, patients who aren't advocating for themselves in the modern Western medical system are more likely to get, often likely to get hurt or rather than helped if they're spending a lot of time in it. And so, how do we, as Eastern medical practitioners who have a modality that really believes that it is your body that is doing the healing and your health really is in your hands and you have the power, how do we sort of empower our patients to move into that system with more of a voice and an understanding of their own needs so they can
Hmm.
advocate for them? It's hard to do in the short time slots we have.
Mm.
Sure. That and the
What-
generational issues that happen. So in the older, like north of 60, like older boomer like younger silent generation folks that believe the doctor is right and they
Mm,
don't want to be a problem. Like I've had instances where a person has been, complaining of a symptom that has long gone untreated and that they didn't feel like their provider was really talking to them and they didn't really understand some of the instructions they were given. And so I've helped them to advocate for themselves to reach out because like I don't want to be a problem. I don't want to, annoy them. I know that they're busy. Like I've heard that a lot of
mm,
times and I've bounced it back and said, this is your, like what you said, Maya, like this is your body, this is your health care, you're important. And I promise you, they're not judging you. They are so busy. They're going to address your concern. And I can almost guarantee there's going to be no judgment attached because I
mm,
mean, the honest thing is that they're whipping through these messages. It's usually a nurse that's triaging the messages from the portal anyway, so it's
Yeah.
just like reach out and get the information that you need. And you're not doing it in
mm.
a disrespectful way. You're doing it in a way that's helping you to have the peace of mind and get the care that you deserve and that you need ultimately.
Mm.
Yeah. It's
Amen.
wild times we're in, folks. So many ways.
Yes.
Yeah.
I was just always thinking about this. It's so nice since we're a team of one, right? It's so nice. It doesn't go to somebody else and lose track of it. It's all our responsibilities, right? When patients come to see us. So I feel like that is sort of nice. Um,
Mm.
we don't have to, nobody else lets us down. We can only let the patient down, especially since we're just mostly solo practitioners.
And we let ourselves down. There's
Yeah,
that
some
too.
we could do that sometimes. Yeah, ideally not. Um, how much Psalm are you practicing right now? Is it emphasis for your practice or?
It's an emphasis in my practice. It's been fascinating
Mm,
using it in the clinic, especially because my colleagues in this practice, so the ones who have been there a long time, the two of them use 16s
hmm
and practice a kind of acupuncture that is very, very gentle.
hmm
And I think as a new Psalm practitioner, I imagine that as my skill improves in general with needling and specifically with Psalm points, there will be less discomfort involved for my patients. But especially as a new practitioner, Psalm can involve quite a bit of discomfort. And it's actually been very validating to see in the videos where you are showing point location that even your patients, even with your skill, right, and your years of practice, the points in and of themselves can be just uncomfortable.
Yes.
But yeah, I would say I'm practicing, but it really depends on the day. There are days when 50 or 60%. I mean, I'll see anywhere from 8 to 11 patients in a day, and I work about 3 days a week. It's shifting a lot because I'm a new addition, and this is the first time the practice has had 4 people, so they're figuring out logistics. But sometimes I'll practice it on half or more of the patients that day, and sometimes just 2 or 3 treatments. But I'm now at the point where I'm using it, I would say at least a couple of times a day.
Mm. How do you
Um,
decide which avenue to go through?
whether Som or traditional Chinese medicine. Well, if I can at all use Som, use Som.
That's how
Um,
you rank it, right? If it feels like you got a good diagnosis, then you follow that.
if it feels like I've got a good diagnosis and I feel like the patient is an okay candidate, so I've moved away. It's hard to say sort of your advice when I think sometimes we're watching videos of yours and taking notes and everything you say lands as sort of like as if you wrote it down in stone when really you're having a process and teaching and may make comments that are contextual or were true at the time or you didn't mean to have so much weight behind them. But in
Mm,
my book, Toby says like don't warn them about the pain, right? Um, and so I've had an interesting sort of evolution of how I talk to patients about the needles. I've learned, so I had one case that I mismanaged quite badly with someone who's had a fair amount of medical trauma.
mm,
Um, and I really surprised him, and he came in I explained a little bit. This is a modality that comes out of Korea, and it's a strong modality, and I think it could be very supportive, and I think you're a good candidate. But I didn't give a heads up about the intensity of the needles, and I surprised him, and he came in the following week. This is someone who had like treatments, too much electroshock therapy, and they like
mm,
damaged his short-term memory and just like a lot of medical trauma. And he came in the following week saying, essentially, he looked at me, and this is someone who's not usually very direct, and he said, "What happened last week can never happen again. I
mm,
spiraled into like PTSD from that treatment, from sort of the breaking of the trust between us."
mm.
Um, and I apologized profusely. And shortly after we wear white coats. And shortly after that, I started taking mine off when he comes in.
Great.
Um, And that was helpful. But yeah, and then so I slowly moved to language that's more like it only uses 4 points because I'm in my first year. I use the 4 points at every SOM treatment. The needle sensation can be pretty intense, I say. And then often patients ask, will it hurt? And depending on the patient, I've just learned that I'm actually better off being really honest and getting
Yeah.
buy-in. And actually, for the first time last week, and so I've been practicing some first on myself and then on patients for maybe about 4 months now. And for the first time, I had to stop a treatment because like I didn't get all 4 needles in because the patient was yelling so loudly
Oh,
that
goodness.
there was just no way that it was legitimate for me and her or for anyone else in the building to keep putting needles in her.
Yeah.
That was interesting.
That's two unusual, from my experience, that's two unusual things, right? For the patient to come back the following week and just that never can happen again. And then also not able to put all the points in and yelling so badly. So that's, again, I think probably I don't have that experience now just because patients are so selective, right? Mostly word of mouth, and they just say it's going to be 4 points. It's probably going to be uncomfortable. And so patients are coming like that. So I think this is probably the most difficult time as you're getting your needling technique really refined, and then just people don't know, right? So I think that's a tough spot to be in.
Yeah,
Mm-hmm.
and I mean the person who was yelling so loudly, it was the stomach supplementation, which I don't consider like of the more painful
Yeah.
SOM treatments. That being said, it's also different speaking to my colleagues in California, seeing primarily insurance patients and seeing patients who are paying out of pocket in California, we see pretty different demographics.
Mm,
Just in terms of people who can afford to spend what they spend on acupuncture in California and people whose insurance covers acupuncture here in Massachusetts.
yeah.
Even just that. So,
I feel like, yeah, my cash patients, they just want the problem done out of the way.
right.
So, I think, yeah, that's just a really different dynamic, right? And maybe
Mm.
insurance people are looking for a more relaxing experience or something like that. So yeah, you may not be able to serve them properly,
Yeah.
especially if it involves Jing Wells. So, but
Mm.
anyways, from my experience, right, patients want something done in that visit. So
Right.
I
Right.
think,
This is very different, right? Whereas I have anywhere usually from 12 to 36 treatments with
yeah,
a transplant. And I've also learned maybe to build a little bit of rapport with a patient before I even suggest some if I think they're a medium on the pain. Angelique, I don't know if I told you this or not. The other day I was needling one of Tim's patients. He was on vacation and she was seeing me and I thought she was a good candidate for some. I explained it and then I started needling and she had the best line anyone's ever had while needling. She goes, well, you're not making any friends doing that. And I said, that's okay. I have a lot of friends. So,
that's super funny. Yeah, it is. Yeah, it is. Yeah. Sometimes I do, I do, especially patients, sensitive patients. I do check in at the end of the four and say, "Oh, is our therapeutic relationship still okay?" So that's
The
that's a little
good
bit in
thing
the
to
friends
ask.
realm. Yeah.
That's almost as good as a patient of mine that tells me that she comes to me to get punished to feel better.
Yes. But there's no free
that's
lunch, right?
lovely.
I mean, again, if you really want something to happen in the body, there's a little price to pay. So sometimes needle discomfort, right, is that price to pay, right? There's nothing that really happens in the body without something you have to stimulate it a certain way to get a really big effect. So again, yeah, if patients aren't up for that, at least for my practice, then I just refer them to somebody else if they're that doesn't want to do strong sensation or something like that. But like I said, everybody, it's self-selective, I guess, at this point, but
Right.
everyone's coming in like, okay, it's only four. He helped my friend, my brother, you know, my
Yeah.
son,
Right.
so they're
Right.
so prime. So
Yeah, you also have better, I mean, you're sort of in a different landscape, right? Just being where you are and with your success rate and your experience and being in the first year of practice, different landscapes.
yeah. But I still, I mean, I remember that acutely, yeah, getting started, right? And just so unsure about the diagnosis, so unsure
Yeah.
about the point location, so unsure about the needle thing. I mean, just so much question marks, right? And then
Yeah.
just kind of hoping that went well. So I still I reflect like on that acutely, so I can really sense that. Yeah, I mean, the key thing is that there's no substitute for clinical experience. You just have to keep layering that clinical experience, and then that's
Yeah.
um,
And even if that means some bumbling on the way through or making people
it,
scream or having those hard
it,
conversations.
It has to be
inevitably.
like that.
Yep.
Um, they have a saying in China, right? If you want to be a good calligrapher, you've got to waste a lot of paper. And
Mm,
so, I mean, as clinicians, we have to,
mm.
we're going to make some errors, right? I mean, it just
Hmm.
has to happen. The nice thing about the sound system is you can correct all those errors, right?
Okay, so I have a question about that.
Oh,
Hmm?
ask.
It's a case. I had someone come in, big guy, slightly dry skin to the touch, but sweats a lot, wakes up at night so sweaty that he needs to change his shirt. This is happening like
Mm.
4 times a week, complaining of numbness and bilaterally, but primarily in his right hand. Um, so I supplement large intestine, thinking that even though the skin is a little bit dry, all the sweating would indicate that it might make sense to dry in and out. And he comes back 3 weeks later and tells me that it's never been as bad as when he left. This is one of the only times I've given myself the wrong treatment, and that was terrible. And I've
Mm.
seen patients not improve and wondered. And I've seen a lot of great success, which is why I keep being so enthusiastic about it. But this is the only patient I've had come back being like, I'm worse.
Mm.
Um, and so, but I was so two things. First of all, he was new to acupuncture and he was new to me. So I didn't feel like I was going to supplement his spleen channel and keep seeing him. I was like that I need a little bit more to this relationship
Mm.
before I can do that. But I was also hesitant. So I did sort of a TCM treatment and I got him back to baseline with that TCM treatment. And then I saw him again and I gave him another TCM treatment, hoping to gain some improvement and gain some rapport before I go back to SOM, which I would like to do. But do I, in that case, in your world, Toby, would I then supplement the spleen on someone who has excess weight and is sweating a lot because large intestine worsened their condition?
I'd like to Angelique to answer this, and then
Oh,
I'll
I knew
answer
you
it.
were going to do that.
Well, she's prepared because I've asked her already.
Okay, okay. Angelique's getting to know me.
Oh, goodness. This is the person. Okay, I think I remember because in the chat you had mentioned it, right? Okay.
Yeah.
So I asked a lot of other questions. I asked like what the inside was like. Was it dry or was it wet? I remember I mentioned you had mentioned I remember ascending symptoms. You had tinnitus. Was that one thing that you had mentioned this
Different
person had
case.
going
I run a
on?
lot of I text Angelique about a lot of my cases, so you're understandably mixing them up. But,
Okay.
but yeah,
I guess in
she
this
always asks
case,
good questions.
if the if it went that bad, then yeah, supplementing the spleen. If you know for sure that the large intestine made it bad, like that's your way. You're like, okay, I know for sure this is wrong, so he must need the spleen.
Yeah.
That would be my answer.
Yes, that's my answer too, because the only thing you know for sure is the patient's response. So if you're sure it's from the needles, right, I would really drill down on nothing else you did, nothing, something else. A lot of patients, they want to attribute all the bad things to acupuncture and all the good things to something else that they did. So I would drill down to that, but if you're sure, then I would do that. And then also, I mean, look for, again, because it's a metal earth phase that we're discussing right now, the body type is predominant, but that's not exclusive, right? So I would look at a little bit more in the personality a little bit too, see if you can see something else, some other sign. And if you can see even a glimmer of that, then I would consider spleen. Because again, it's all theoretical till you put the needles in and then get the patient's response. If you can really trust that response, and then for sure, and it's so against what you're looking for, then I mean it lays it up for you that
Yeah.
it needs to be done the other way. So
Okay. Yeah. Thank you. I do. I see a glimmer. He's stubborn as all heck, and yes, I think I see some large intestine excess in the personality.
yeah.
Um,
If it makes you feel any better, how you presented it, I might have done the same, right? Especially for that numbness, with that
Hmm.
sweating at night. Um, yeah, I
that
mean,
does make me feel better.
okay, good. But yeah, but part of that caution, right? If I saw that really dry skin, right? That's,
Right. Stomach
you
would have
know,
been maybe a safer.
maybe.
It's confusing when that happens, though. I can relate when someone's really sweaty, but like under the sweat, they're dry on the
Mm.
surface because you're like, oh,
Yeah, I tend to, what are they doing most of the time? That's sweating 4 times a night for a little bit of time. So that's, it's mostly dry, but with some damp. So
mm,
I
Hmm.
would I would just go to that,
less
it's
weight.
more baseline dry.
Hmm.
And then with that stubborn, right, then that's
Yeah, helpful.
again, it's completely reasonable to do this to supplement a large intestine, but with those new ideas and that response, right? Without that response, there's no reason to supplement spleen.
Right. Um, is there anywhere, Toby, where you talk about external invasions and some?
Yeah, I've talked about that a little bit. It's just basically like you understand the fundamentals of the system, right? Small intestine's good for wind.
Right.
Real extreme heat, you can do bladder, minor heat, liver, all those kind of things, right? So depending on how it's going in and phlegm, you can
Got it.
treat dampness wise. But there's a special part for the SOM system for really early stage external pathogenic invasion. Then we use the bladder. And I've been able to do this a few times. When people are just coming in, say like half a day or a day in, they get this sore throat and they feel like they're going to go down, then bladder has been amazing.
Good to know. Thank you.
If they don't need the really cold nature, then
Mm-hmm.
my teacher would only do the 2 points, large intestine 1 and stomach 36.
Okay.
Why that one? Is that because of where we get the invasion? We're trying to, I'm trying to think of like this, it's descending the bladder channel. Explain. I'm trying to visualize why it works.
Because the Taiyang, right? So we're just flushing the Taiyang. This is a little bit
Uh,
risky, right? Because
mm-hmm,
let's say it is a cold invasion. I mean, you can do this for wind, cold, wind, heat. You can just
mm-hmm.
flush it. But let's say it's a cold invasion and you haven't caught it on the surface, and doing bladder,
You drive it
that's a
in.
little. That's a little bit risk. We're just adding, cold to cold. But
Mm-hmm.
like I said, early stage, decent, robust, presentation for the patient, then I mean, it's really, yeah, it can be like magic. So everything that you already know, but that's a special one for external pathogenic factors is to supplement bladder for that.
And only the first 2 points if they don't need the cold.
Yes.
Okay. Thank you.
Thank you.
Yeah, yeah, of
Good
course.
one.
Yeah.
A good time of year to be having that under our
Yeah.
belt.
Gua sha.
Yeah, yeah.
Gua sha too. I like to do gua sha when people come
Uh,
in with the
uh,
cold.
uh, all right. That's
I
not a
love
part of the
gua
SOM
sha.
system,
I
but okay,
know, but
Angelique.
it's so good. Do you do gua sha? Maya,
She's
do you
talking
do
to me. Oh,
gua
you're
sha?
talking to
Yeah.
me.
Yeah, yeah.
I do gua sha since we got together at a cafe 3 months ago, and you were like, "I'm crazy about gua sha. Here's why I do it." I do gua sha more since then.
Good.
Uh, I do it when I can fit it in. A lot of my calculations are around time, and
Mm,
I hope to become more efficient with that. Time management can be, I don't think it's hard for me specifically. I think I'm ambitious. And um, I think in your last, you guys, Toby was saying you do 25% of what you want to do with a first time
Mm.
patient. And that was helpful. I'm so trying to bite off more than I can chew with patients. And so, often I'll gua sha if I feel like I have the time.
Time. How
Because
much
you
time
said
are
you
you
do it.
having per patient?
So we see a patient every half hour,
Mm.
and we have a front desk, right? Like you see a patient every half hour, and you don't even have a front desk.
I modified, I'll tell you, because I don't go
Oh,
every
good.
half hour continuously anymore. That was nuts.
Yeah, that's
That was crazy
impossible.
making. Nope.
But yeah, every half hour, and I don't need to deal with anything beyond treating. Or I do, if I'm giving them herbs, granular herbs, then I have to measure those out. We're figuring things out still.
Mm-hmm. That's quite a
Yeah.
pace,
You do gua sha after needles though, right, Angelique?
usually.
Yeah.
Unless someone's super, super stressed. Like if someone comes in the room and they're like vibrating with energy and they're like so stressed out and they're like their elbow like this presentation or they're like their shoulders are up by their ears and they have some neck pain and they're like freaking out. Like you can feel the crackle of energy on them. I'll
Yeah.
sometimes start with gua sha just to relax them to then get them on the
Mm.
table. But that's rare. Usually it's after. But when someone has early stage EPF, gua sha, like to the neck and upper traps, is has been really helpful. It opens the pores.
EPF.
It's like manual exterior pathogenic factor.
I see.
Yeah.
Thank you.
It opens up the pores and kicks it out. So I've had that help with either stopping the invasion or having it be less.
Nice.
Yeah.
Okay, good to know. I recently started coming down with a cold and made the mistake of deciding that I was over it before I was over it
Ah.
and went
mm.
back to taking my Xiao Chai Hutong
Uh-oh.
and plummeted myself into the depths of I don't know exactly how that worked with the herbs. My herbal game is not particularly strong, but
So
I'm
to make
seeing
it worse?
I got so sick boom,
Oh
like
no.
throughout that day of taking the Xiao Chao Hutong. Unfortunately, too late to realize after I'd taken the evening dose. I was like, oh, but there may have also been some other, we love to blame the herbs. There may
That's
have been
right.
other things going on.
Yeah.
Yeah.
Yeah, from my limited experience though, sometimes Xiao Chai Hutang will do that though, right? Just release other pathogens that are in the body. So especially that complicates healing. So
I see what you're saying. You're saying now I'm really purged and I'll feel amazing in a couple of days. That's great
you,
to know. Thank
yeah,
you,
you
Toby.
you'd be much better on the other end of this, but it's
Perfect.
best not to complicate it at the time. And also, I think this is so much better. Any kind of clinical experimentation on yourself is so much better than on patients. So that's good.
Agreed.
True,
Yeah.
Yeah,
true.
but
I
And
finally supplemented the lung channel on myself after a long time of hesitating because I consider myself so damp on the inside and damp on the outside
mm,
that I was scared to supplement lung. But it was probably one of the more successful, more impactful salve treatments I've done on myself. So I actually did it today, being like, okay, my Wei Qi needs a boost, and
mm,
I felt quite a lot better
that's
good.
great. What any other factors that besides weight Qi needing a boost that you thought about for your
today.
for your diagnosis for supplementing lung?
Mostly, honestly, today I was like, at like 30% cognitive capacity. I was feeling pretty icky, and I was like, okay, well, not this one, not this one, not this one. It was a little bit of diagnosis of elimination, and just knowing that it's worked in the past.
Mm.
Um, and well, just like, feeling a little bit of restriction in my breathing. And no, I can't say that there was too much thought went into it other than it seemed like a safe bet.
Yeah, but especially that's good too. Especially that's the best way to put Qi in the body by supplementing lung. So I think that's really
Right.
reasonable with that kind of presentation.
That was the reasoning.
Okay,
Um,
nice.
I'm
yeah.
curious about what your wrong treatment of self was and what happened, if you feel comfortable
Oh my
telling
God.
us.
So I am a like very clear gallbladder excess and constitution. Like I will fight at the drop of I've had to really learn some behaviors because constitutionally I'm just like very gallbladder excess. And I was actually texting with a colleague of ours about something that was going on with me. And I had supplemented pericardium before and had felt and had been good.
Hmm.
But on this day, something was going on, and I was texting with a colleague who also practices some, and I don't think doesn't see me as the like aggressive, insane person that I am on the inside because she has such a loving view of me. And so she was like, well, maybe gallbladder could address this and this. And so I supplemented gallbladder on myself, and every needle was so excruciating. I mean, and when you're practicing Psalm on yourself, like first of all, I'm starting with my left hand on the right side of my
Mm,
body, and they're thick needles, and I'm not experienced. I'm doing them slowly. Like I have to say, when you're doing it on yourself in the beginning, it's painful.
Hmm.
And it's exciting and fun and super worth it. But like these were the most painful needles I have ever had in my body, even like through acupuncture school when people who didn't know what they were doing were practicing on me. Like it was so, and then I finished the fourth one. It was actually really funny. So I finished the fourth one. My partner, my girlfriend was on her way. She was like meeting me at the house like half an hour later or something. And I lay
uh-oh.
down and I was in so much pain. And immediately I was like, she's going to be late. She always does this. I'm going to pick such a fight with her when she gets here over this and this. And just like but I was in so much pain. I texted the colleague being like, I don't think I can lay here for 20 minutes. Like, I'm in too much pain. And the colleague was like, take him out, balance it out with pericardium. So I took him out and I put him in pericardium. And I am not kidding. My thoughts turned to like, you're late too so much of the time. She's trying her best. Like it was such a 180 from like, I'm gonna pick a fight to like peaceful sort of understanding. And I was like, okay, we're back. We're back in equilibrium. It was interesting.
I'm glad you recognize that. You better send a thank you note to that colleague.
I sent her many thank you notes. She's
Okay, that's nice.
But now you know what it feels like,
now I know
right?
what it
The
feels like.
wrong treatment.
I did also, this is a curiosity, Toby. One time I supplemented, someone had a pretty clear indication for, so pain on either side, pain along the UB channel in the back, pretty acute pain, level with, there was another indication, he like really seemed like a heart excess, darker complexion, so harder to like separate obvious redness, but still like sort of like a redness to his presentation. And I supplemented UB. Also, he'd never had acupuncture before. The needles were excruciatingly painful. I saw the big eyes, like the terror eyes. I took out the needles. There was no way that I was balancing. Gave him a TCM treatment. He came back the following week and said the pain, which had been present for like over 6 months and was really severe, went completely away the next morning for a few hours and then came back.
Hmm.
And so at that point, I was pretty confused. I was like, it was the wrong treatment. It wasn't the wrong treatment. Then, of course, but the TCM treatment I gave him was a three. I put in Shenmen, Li4, and liver 3. So a little bit like what Angelique was also saying the last episode, I was like, that's a really basic treatment, but acupuncture is powerful. Was it the TCM that
Yeah.
made him feel so much better?
Yeah.
But have you had treatments that you thought were, I don't know, I guess, yeah, curious what your thoughts are on that.
Every day in clinic, right? I'm never sure about anything. And then you always have to wait and see it play out. But especially
Yeah.
with those two variables, right? Then you're not sure what gave him that little bit of temporary relief the next day.
Yeah. Well, it's fine because either way, he was never gonna let me put more Som needles on him. So
Okay. Plenty of other patients out there that are eager to change their
Yeah.
medical condition quickly. So
this is true.
mm.
They'll find you and you'll know.
Yeah. Well, I have many more questions if that's the direction we want to go in, but we also
Angelique's ready.
Oh, am I? Okay.
perfect.
Ask some
Um,
questions.
okay, here's a
And
question for you, Angelique. Something I realized, I also you two are like, this is a podcast for all things Chinese medicine, but then you spend so much time talking about Som, which I love.
yes,
I don't want to listen to anything else, but I have wondered if practitioners who aren't practicing Som um are hanging in there. Do you guys know?
I don't
We
know.
we haven't got any feedback about that yet, but I thought about that.
Yeah.
We try and mix in other things, but I mean, this is my main tradition for acupuncture, so obviously we can talk
Right.
about it. And Angelique's, going into practice and using this a lot, so it just comes up a lot. But yeah, I feel like yeah, we try and talk about other things, but yeah, that's one of
Kind of
our
like the
main.
default.
That's our
We
default
should probably
default.
It's
change
all
our
I want to, it's
tagline.
all I want to talk about, but I was
So
just curious because your tagline, yeah, it kind of says
it's kind
so.
of like all things. Yeah, we that's a good point.
When you started practicing, Angelique, so something I
Hmm.
realized recently is I started practicing and I was very much like attached to my notes, right?
Hmm.
And I never actually, so there are point prescriptions that I now have memorized because I've done them enough,
Hmm.
but because of the way my brain works, because of sort of, well, I could make so many excuses, which by the way, I think is a stomach excess constitutional inclination. I haven't memorized the point prescriptions, and I've realized that that's really a mistake.
For
Because
some?
yes, because I need to look at, I have them on my computer as a phrase in Jane. So they just pop up. I type in slash stomach plus and it pops up. And
Hmm.
some of them I do have memorized. But the need to sort of look back at my computer to see what points I'm doing really pulls my attention away from how well I could be needling, point
Hmm.
location, and sort of focusing on the duchy, which it makes me laugh that Toby is like, you can't miss it. I'm like, Toby, you can't miss it. I can miss a lot of things that you can't miss, let me tell you. But did you ever sit down? My question is, did you ever sit down and memorize, spend any time actively memorizing the point prescriptions, or did they just come to you with repetition?
They still haven't come to me.
Okay.
I use a card. I actually have it.
Okay.
This card.
Oh wow.
My,
Okay.
I'll send that to you.
I
I
love
can
that.
see it.
But that
So I
Yeah.
doesn't
have
have an
it.
order, does it?
It in
Top
order
down.
of the it doesn't have them paired, but it has it in order of the sequence of the channel. So like
Right,
longer.
but the points, because Toby, you say the needle top down, right?
It
Yeah.
Is
has
yours?
them, no, they're not in order. It goes
Right, it's
supplement,
like
supplement,
supplement,
drain,
supplement,
drain.
drain, drain.
Hmm.
Right.
But I think it's more important, yeah, to make sure you're supplementing or draining. So that's why I group those together rather than top to bottom. So I
Fair.
had to make some decisions with that
Um,
card. But I'll send you one.
I love that.
My office manager will send you one of those because
Great.
again,
Thank
I
you.
think that's what I did, right? I didn't have a printed card like that. I'd written my own out, but I had a piece of paper I'd bring in with me and put on the patient's table because just they wouldn't see that. But I think all your effort should be going into diagnosis and not into remembering those 4 point combinations. So it's nice to have
Okay.
something with that.
I'll
And then
take that.
eventually it just comes, right? Eventually it
Yeah.
just
Right.
comes.
There's some channels
Um,
that I know now because I've used them so much. So I
Right.
don't have to look anymore. But some of
Same.
the oddballs, like I don't supplement bladder a whole lot or
Yeah.
kidney a whole lot. I gotta look at those.
Toby, when you're needling yourself, do you still go top down? Because it's very uncomfortable to lean in towards my foot to put needles in my foot when there are already multiple needles in my hand.
Yeah, I'm not sure if I talked to you about in the video you watched, but actually it's not top to bottom. There is a point combination that we do in Psalm for the 4 points, the order. But my I think the second to last time when my teacher was here, we had like an entire half day set aside to discuss that. And something happened. I forget what we had to do. We had to treat patients or something like that. And so we never got to that. So as I'm driving to the airport, he just said, do everything top to bottom. So there is an actual point combination. And I think it's a little bit involved because we had a whole half a day set aside for it. So I still don't understand what that is. But that's his default is just do everything top to bottom, but there is a combination. So when I treat myself, I'll treat bottom to top usually.
Good to know. Thank
That
you.
Yeah.
seems like a lot. That seems a lot easier
I'm gonna do
to
that
do.
from now
Yeah.
on.
Especially my
Yes.
left hand's really useless. So,
Yeah.
at least I can do the bottom half, with my right hands.
Cool. But don't you normally treat on your left anyway? Good.
Depends on what I need to do, but yeah.
Okay, next. Angelique, will you speak a little bit to this, and both of you. The kidney small intestine, like the way that it's been presented, um, I struggle with it because I find that like this warning not to consolidate pain and trauma. It's like when someone is a small intestine excess,
Hmm.
we wear our lives on our face, right? We wear our beliefs on our face. We wear our life experiences on our face and in our bodies. And when people are small intestine excess, by definition, it's not necessarily just an asymmetry that they were born with. I
Hmm.
find that like when I look at someone and I'm like, wow, you present as a small intestine excess in that way that is kind of cringy about Sa'am when we divide people into these categories, which still is like a little hard for me to sit with peacefully. But whatever, the judgment is there and I use it diagnostically. Inevitably, almost always, those people are going to have trauma and pain that I don't want to consolidate by using the kidney channel. And they're coming in often for pain. So now I'm looking at someone who might very well benefit from a small intestine supplementation other than the fact that they're presenting small intestine excess. And I understand, Toby, you've said that of all the channel pairs, this is the channel pair that is most likely to sort of have someone who needs both, but often they're not older patients. And so then I don't have this sort of reasoning that potentially because of their age, they need both the kidney and the small intestine channel supplemented. So I guess I've kind of finding myself a little bit writing off the small intestine excess presentation if I think a small intestine supplementation will help with their pain because of the presence of blood stasis or because of recent surgeries that seem to have contributed to the pain. Do you see what I'm saying?
I think so. So have you done it and it's been helpful?
Yeah, mostly. It's been a little bit of a mix, or sometimes I hesitate and I do what we're taught, which is I try to go to more obvious gaps. But I wonder about coming back to that with those patients. And I wonder about your thought processes with these patients and again, the patients maybe that I'm seeing, they're not selective around patients who have a certain amount of money or have found a certain amount of money. Like patients who are paying it out of pocket in California, like either they have it to begin with or they have put their minds to it to an extent that they are sourcing it to figure it out, right? That's not the case here. So I might also be
Hmm.
seeing sort of more patients who are just less resourced, you know?
Hmm. So the way I've looked at it is basically I like really just finding the most imbalance. Because if I have a question, and this is where I had a patient where I went wrong on me, where I thought small intestine would be the one for them. I think I might have even talked about it. I can't remember if I
Yeah, you
talked
did.
about it here or if I talked about it with just you, Toby, but this patient had pain and it was pain on the small intestine channel. And they were pretty close in their kidney and small intestine excess, but I thought like I'm going for it. And so I did the small intestine and the pain got worse. And so
I
then I
think you
treated
did
them with
talk about it.
kidney and they got better. So I think in the context, and for me, when I'm not super sure, I go with what is most obvious, like what the grossest thing in the room is, like what's the most obvious thing and what
Yeah.
their biggest imbalance is. So even if they have a lot of pain, if they are a small intestine excess person, I would be less, especially having had that experience, less inclined to use that channel. I would use something else. Toby, what do you
Yeah.
think?
Yeah, I think I want to go back to the first part of that presentation. Like you were saying, it's a little bit cringy to diagnose with this. I definitely understand what you're saying about that, right? About the attractive, non-attractive part. Is that what you mean, Maya?
Hmm.
Yeah, that's I definitely recognize that. But patients are paying us for our clinical judgment, and so our judgment is the most valuable thing that we have. So try and move. I understand that, but try and move away from cringy and more towards, oh, this is my clinical judgment. This is how you're presenting, and this is my clinical judgment. A little bit like you would with hot and cold. So
Right.
attractive, not attractive is the same. You don't think, oh, it's cringy to go, are they hot? Are they cold? So try and make it just a little bit more clinical judgment. And I remember one of my other classes too, the one of the participants in the class was like, I don't want to judge people. And I had to say, I mean, that's our job, right? We have to judge
Right.
people, right? But again, clinically, right? We're hot or
Right.
cold, wet or dry, ascending, descending, in or out, all these things. We're just really trying to judge that. So just anyways, I
That's
recognize
helpful.
that.
Thank
Yeah,
you.
but I recognize that too, that uncomfortableness. Now I moved past it, but I remember having it being really uncomfortable about that. But it's really important. So just the cleaner you can diagnose, especially that dynamic, the better. And
Thank
then
you.
in general, yeah, I think you're right. I mean, you don't want to consolidate pain in general for Chinese medicine. But if it's small intestine excess, and they have pain, then you have to use the kidney. So it's like in general, try not to consolidate pain, but if it's the small intestine excess presenting like that, then you have to use it. So yeah, so many
Yeah.
times I've supplemented kidney successfully, um, to treat things. So especially pain, but again, your first thought is probably pain supplement small intestine, right? Because
Right.
almost always we have to move, or like you were saying before, maybe move back and forth between both of those. And
Hmm.
Right.
especially if it's pain and you're going to move back and forth between both of those, maybe start with small intestine because that's less likely to congest everything, especially if you get everything
Right.
moving and then come back, you have some space to consolidate. That's in general to do.
Unless they're presenting as a clear small intestine excess, in which case you
Yes.
wouldn't start with small intestine
Yeah, there's no reason to.
supplementation. Right. Would you ever move to that with people who are in pain after using kidney? Or you just no, period, no, because that's their excess. There's no reason you would ever move to that.
Patients are always changing.
Okay.
So I just always try and reevaluate every time I see them. You're right,
Right.
like structurally, symmetry wise, they're not changing. But I guess people,
Sometimes
attitude,
they
things
are.
like this. And let me remind you about this too. My teacher really said about the channels, if the patient feels in their heart of their hearts that they're like that, then you have to treat what they really feel in like their heart and heart. I remember seeing again, we were treating patients in St. Louis or something, and we had a patient come in that in her heart of her heart, she really felt like she was a kidney excess, dressed that way, all kinds of, presentation like that, but just structurally that just wasn't there. So, but we did supplement small intestine for that case because that was the
Mm,
assessment in her heart of her heart. She really felt like she was,
helpful.
just really attractive and everyone was really into her. And so again, so that's again the structure guides, but we have to take
Yeah.
into part the whole picture.
Thank you. That's helpful. And a follow-up, of course, in an attempt to oversimplify, and it's not this simple, but if you'll indulge me or tell me that I can't, if I see a patient and I supplement, they already have a gap, and I supplement the wrong channels. I can't see what you're seeing because I've hidden my self view. So if my hands stop making sense, let me know. If I see a patient and they have a gap and I supplement the one that is in excess, so
Hmm.
now they have an even bigger gap. And I see them the next day, or I realize in that same moment, and I supplement, or the next treatment, I supplement the opposite channel to bring them back to where they had been. Logic would then have it that the next time I saw them, I would yet again supplement the channel I had missed the first time to sort of continue pushing them in the direction because now I've just gotten by them back to where they were, or not necessarily the case.
It seems from my experience that patients metabolize the wrong treatment a little bit worse than they metabolize the right one,
Meaning what?
Meaning
meaning
what?
that they get more effect from the right treatment and less effect from the wrong treatment. So you
Got it.
actually be a little bit
Okay.
ahead that way.
Got it. Okay.
That seems to be the case. Again, I just limited clinical experience, but that seems to be the case.
Thank you.
Mhm. Hey, Maya, do you have any more questions, especially really difficult ones for Angelique before we go?
Theoretically, could someone be a spleen excess so that they're damp on the inside and damp on the outside, and say a stomach excess in other ways so that they're damp on the inside and dry on the outside in other ways.
Yeah, they can.
They
For
can. And you
example,
see, yes,
yes.
tell me.
So someone who has super loose stools, like lots of loose stools all the time, their mouth is so dry, eyes are so dry. So they're damp on the inside and dry on the inside. Then they can also have really shiny face, like really kind of like almost like me, like shiny face, and then dry rest of their body. What
Okay.
do you do?
Sounds
It's horrendous. So, right? So then that's where so I'm thinking there's a particular patient that I have that's similar, not fully. I was a little hyperbolic about the shiny face. She doesn't have the shiny face, but I have a patient that her dry mouth, so dry, loose stools all the time. And I have treated her, and she also has really bad, she got postnasal drip. So drippy nose, super dry mouth, loose stools. So I have done both lung and stomach for her, and I've tried them both. And the stomach tends to work better than the lung.
Huh. And so you think large intestine would also work well on her?
I've done large intestine on her also. And none of them have been like, ah, you know what I mean?
Huh.
So
Yeah.
I've also treated her. She was a liver excess constitutional type person, so I treated her with Sanjiao. She is someone like over the course of time, I have seen a change, but nothing has been like spectacular. Like she would email me and be like, "This is slightly better for like a day," or "This is feeling better." But I noticed like she's a person who was just and her affect was much brighter. Like her
Mm,
eyes got brighter over time. Like she just
nice.
seemed happier. Like she's
Yeah.
someone who I was like, I don't know if she's gonna come back ever to see me. And she comes back all the time. You know, she became
Hmm.
like one of my biggest fans, someone who I was like, oh, this person is definitely not coming back here.
Yeah.
So yeah, you just try to define like the biggest imbalance. So like I think
Yeah.
on one of the stomach excess days that I treated her with a stomach plus, she was really, really drippy that day. So that was a bigger problem than her dry mouth.
Right.
And on like really bad dry mouth days, then I supplemented the lung.
Yeah, I have to say the contextual inside outside for the dry, damp situation with those phases is incredibly unhelpful, Toby. Very unhelpful.
It gets better. That was my feeling. I just pressed my teacher, and it's pretty bad when you're pressing a Buddhist monk. You got to tell me what's the
Yeah.
answer, right? So that would, but again, now it's super valuable now, but in the beginning that is a little bit difficult. And I really agree with Angelique's answer to that. Yeah, I mean they could be, but it's a little bit less likely, right? It's a little bit less likely to have those contradictory things to happen. So it does happen, but it's less likely.
It happens.
Yeah.
Hmm.
Like in clinic, everything happens, right?
Everything happens.
Like you were saying, numbness, and then it got worse after supplementing large intestine. That happens, right? That is again, we have all these guidelines and things like that. But again, now you know that if that's truly from the more numbness from your treatment, you know that that stubbornness is so strong it overpowered the physical findings.
It's
But again,
fascinating stuff.
it's nice to get that feedback directly from the patient, then we know what to do.
Hmm.
Yeah.
And I think it comes down to us too, sort of owning our style and owning it and gathering the confidence. I, like you, when I have had that kind of thing happen, I've fully abandoned Psalm. Just, okay, TCM all the time. Here we go. And just like stuck with it for a while. Totally done the
Angelique,
same
not right
thing.
in front of me,
I
please.
know, I'm so sorry. But it's because it's so painful, especially if someone's had a strong response both to the needle insertion and then their response to the treatment is not great. Uh-oh. I haven't found that confidence to own it myself yet either, so I totally
I know,
feel
but
what you're saying.
that's the best reason to go back to Psalm, right?
I
Because then
know,
you know something for sure then.
sure, but I haven't done that enough times. Like I haven't done to know. So I did that one time, and then now I know that one time. But it's hard because, and I think it might be the newness, Maya. I don't know, but I don't I don't I don't want to be the one that's like, she hurt me so many times and I'm never going back to acupuncture again, you know?
Yeah.
So how I have mitigated that, similar to what Maya was talking about, is okay, let's try a different approach this time and then see how it goes and then try to warm them up again. And that's happened to the point where then the patients who've had it. I did that and then went to TCM and then went back to SOM and they had a good response from SOM. And I
Right.
treated them with SOM for a little while and they're like, you know what, let's go back to TCM. And I'm like, okay. And then treated them with TCM. Then they actually asked to go back to SOM because of the
Nice.
difference. So I think it's okay to have some movement until we have that. Like we'll have to be brave sometimes and just
Yeah.
do it, right? But until we have that sense with that particular patient that it's okay to do it, I think it's okay to do it the way we are in our ginger little fashions.
Yeah. We're
I'm
getting
not
our
sure if
sea
I'm okay
legs.
with it, but I'm glad you guys are.
It's what we have to do
Yes.
for now.
For now. We're
All right.
building our faith.
Hmm.
Yes. All right. Maya, thanks so much for coming on our show.
Yes,
It is really nice to have you as our first guest. It was a
it
real pleasure to
is.
meet you.
Such a pleasure and such an honor. I was really looking forward to meeting you, Toby, and to participating. This is my favorite podcast. I've been going around telling my friends, how many people do you know who get to be a guest on their favorite podcast? I was
Oh,
like,
that's so
maybe I'm
nice.
excited about being the tree in the Christmas play, but I'm still very excited. So,
All right.
thank you.
But real pleasure to spend time with you. Okay.
Same here.
Take
Everyone take
care.
good care.
Bye.
Bye.